What Would She Do? The show about life, love, and relationships, hosted by Saran Almond. Changing hearts and minds, one conversation at a time.
Hello, and thank you for watching. I'm your host, Saran Almond, and this is What Would She Do? On today's show, we'll provide some general information on pet health care, specifically pet cancer. We'll speak to Dr. Christy Montgerard of Fullwood Animal Hospital. She'll provide some pertinent information on what a cancer diagnosis means for you, your pet, and your family. I'm your host, Saran Almond, and this is Pet Cancer, What You Need to Know on What Would She Do?
Hi, my name is Dr. Christy Montgerard. I'm a veterinarian at Fullwood Animal Hospital in Matthews, North Carolina. We are a full-service veterinary hospital. We specialize in small animals and exotics, and we also offer boarding and grooming. There are a lot of different symptoms that can accompany cancer in animals. So one of the biggest things that we typically will see are lumps or bumps, and that can either be in the skin or in the mouth. Abnormal discharges such as blood, pus, or if they develop vomiting or diarrhea are also very common, as well as a change in appetite. So many animals will stop eating well and they'll lose weight. Other symptoms include non-healing wounds, abnormal odors, change in behavior, problems urinating, defecating, that sort of thing. Cancer in pets is actually a fairly common problem. It is the leading cause of quote-unquote natural disease or natural death in animals. It affects 1 in 3 dogs and up to 1 in 4 cats. There are a variety of cancers that we see in our companion animals. Typically, one of the most common cancers we see is lymphoma. We also do see leukemia, mast cell tumors, melanomas. Mammary tumors are also common in unspayed females, cats and dogs. And we also see a variety of carcinomas and sarcomas. Mast cell tumors are a very common tumor that we see on the skin of dogs, occasionally on cats. They don't tend to be as aggressive in cats as they are in dogs. Any unusual mass that you see on a dog could potentially be a mast cell tumor, so we do recommend that all those lumps and bumps that you find on your pet are checked. There does seem to be a genetic link between certain cancers and certain breeds. For example, boxers, we do see a lot of mast cell tumors in these dogs. Mast cell tumors can also be seen in golden retrievers and Weimaraners, see a lot in Bostons and pugs. Feline leukemia, for cats that have feline leukemia or feline AIDS, we do tend to see an increased amount of lymphoma in these cats. But any cancer can occur in any animal at any time. Treatment varies widely depending on the type of cancer and the location of the cancer. If it is a mass on the skin, let's say, you can have that taken off and submitted for histopath. If it turns out to be a fairly benign lesion or not aggressive form of cancer, then sometimes excision is curative. Other cancers are much more aggressive. You can take the tumor off and treat with radiation and chemotherapy, similar to how a human would be treated. But again, depending on the type of cancer, it depends on how it will respond. It really depends on how the pet is doing physically. So if they're doing well and they're maintaining their weight, then a diet change is not necessarily needed. However, if they are losing weight and their body condition is suffering, then we may recommend putting them on a high-calorie, dense diet. And then other times, depending on where the tumor is located, we may recommend a specific diet, such as if they have cancer in their kidney or cancer in their liver, then we may recommend diet specifically for those organs. It really depends on the type of cancer that the pet has. Again, if it is a fairly benign or non-aggressive mass and it can be removed, then sometimes removal is curative. Other masses or cancers, even with removal and aggressive chemo and radiation treatment, still won't respond well, and their prognosis may be very short. Cancer can occur in birds, reptiles, amphibians, fish, pretty much anything you can think of. So again, similar to what you're looking for in your pet bird or pet dog or cat, if you have a bird, look for similar problems. I think the biggest thing is not to feel guilty about whether or not you can afford chemo, radiation, and surgery. A lot of times it is cost prohibitive for a lot of owners, and you should never feel guilty about that. The most important thing is to love on your pet and give them the best quality of life that you can for as long as they have. Just want to touch on preventative health care for just a moment. It is so crucial that we see your pet at least once to twice a year, just so we can do a physical exam on them and make sure that we're not finding any problems. So this is Lacey. She's a 10-year-old golden that we just saw a couple weeks ago. We did some extractions on her teeth, and we're rechecking those today, which they have healed beautifully. We're also going to draw some blood on her for her wellness blood work. So on physical exam, when your vet does this, they'll check your little dog or cat from head to toe. We'll start at the tip of the nose and work our way down, checking eyes, ears, their mouth, lymph nodes, feeling their skin for any lumps or bumps. We'll also check their joints and make sure we don't find any evidence of arthritis or pain. You're okay. Take a look. I know, it's okay. What a good girl. What a good girl. Nothing replaces a veterinarian getting their hands on your pet. We can detect signs of arthritis, signs of pain, signs of masses. We can check masses if you find them. We can make sure that their oral health is good. And then also vaccinations, making sure that they're up to date on distemper and parvo and rabies especially. But then depending on their social status, if they're out being a very social dog with the neighborhood guys and gals, then they probably need some vaccinations that would help prevent them from getting things like bordetella or canine influenza. Other important topics include doing yearly blood work on elderly senior pets. That's one way that we can detect problems early. So doing that blood work, we can see if there's kidney problems, liver problems, problems with their red blood cell count, white blood cell count. Those can all be indications that there's something going on, and I can't tell you how many times I've diagnosed cancer or renal disease or liver disease just from doing those tests preemptively, and then we can get ahead of the problem before it becomes a major problem. It's so much easier to treat ahead of time than it is to play catch up.
Once again, thank you all for watching. For more information on Dr. Montgerard, please visit my website at www.whatwouldshedothe.show.com. There you'll find more information and resources related to pet cancer. If you would like to follow the show on Twitter, please do so at WWSD_the show. I'm your host, Saran Outland, and before we close it out, I want to end on a high note with two members of my own pet family. Thanks again.